Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Parimala Devi, who is a popular gynecologist, obstetrician, cardiologist, and robotic surgeon. And more than that, she has set a Guinness World Record in screening the CA cervix. And today she has come to the basics that many of the youngsters, they are not aware, or they are over aware and they are overusing the pregnancy test. So please tell us, what is this pregnancy test and who has to get it done and when to get it done?
Yes. Good morning, madam. My respectful pranams to you. It's always a pleasure to speak to this channel. This is Adhyatma, Ahara, Arogya, really, which has spread lot of knowledge, and it is one we can say that for children should see this channel more than adults, because lot of so many good things are happening in the world where the bad things are also at one end it's happening. Yes, today we came to this discussion of pregnancy test because it's one of the simple, basic need of a couple or a woman who is trying to become pregnant or who is not trying to become pregnant. This is the one test they usually depend. But there are a lot of confusions and vagaries around this pregnancy test, because pregnancy test is done when she misses the cycle. A lady who has married just 1 month or 2 months, and she is like she is with a langic we call it a sexual relationship. So we are going to tell her, or she herself knows many a times, oh, if I miss the cycle, I should do this pregnancy test. That much of awareness is there with all people now. When they do the pregnancy test, if it becomes positive, then they are happy. There are two lines seen, that is pregnancy. But if she is just married and she doesn't want pregnancy, then she may not be very happy also. What is this positive pregnancy test, negative pregnancy test, false positive pregnancy, false negative pregnancy? This one have to understand. Because in a positive pregnancy test, both the lines on that slide, they are appearing. But in a false positive, one line is there, another line is weakly positive, we say. When it is weakly positive, they get confused. Why this is happening like this? Some problem does only. They get into their own analysis. Already ChatGPT Mahashai has already put them into action. And our Google Mahashai. So what happens? They will understand on their own some few wrong things also, and some myths
and
also.
Presume and assume and come to wrong conclusions.
Yes. So what we have to tell them is pregnancy test, if it is normal, then hormonal level, everything is going on well. Whether they want pregnancy to continue, all those things, and we always coax them to continue pregnancy. That's one thing. We never encourage any abortions as far as possible. But what happens? It is weakly positive. They are worried. Why, madam, it is weakly positive? That time we have to ask, what is your cycle pattern? Whether your cycle is normally 30 days, 28 days, or 35 days, 40 days. Because if it's a delayed cycle, something like 40 days and all, which happens in most of these polycystic ovary girls. Now we have 30% polycystic ovaries, which we have often discussed in this channel because of the food, lifestyle, everything, where the egg release or the ovulation is very irregular. So because of that, their cycles are 40 days or sometimes no ovulation in them. There, the pregnancy test can just attempt of pregnancy can give rise to pregnancy weakly positive. So that time, what we have to do is we have to explain to them there are some conditions like this. Have they taken any medicines in that previous 1 week? Have they used any lubricant during the sexual act? That also is important. Or have they traveled a lot and taken some erratic food, which might have had some effect on their body? All these things we have to tell. The only test which supports us that time for the doctor to decide is beta HCG. Beta HCG is a hormone which is produced from this pregnancy sac, actually from the uterus, because that is the one later on the placenta and all overtakes also.
So that is more specific. It is very specific.
Very specific. 100% we can say that pregnancy is there or not. Whenever we want to rule out totally pregnancy, we depend on this test. But how healthy this pregnancy is, that time also beta HCG comes. Because beta HCG usually pregnancy positive, at least 50 international milliunits like that it comes. And it doubles usually. She has come at missed cycle. Within 2 days, this pregnancy, this beta HCG will double up. We call it as a doubling of beta HCG. So if it was 200, suddenly becomes 400. So pregnancy is growing. Then after some 3-4 days, again it increases by another value. It increases only, it doesn't decrease. If it is a healthy pregnancy. If there is some problem in this pregnancy, it is not very healthy, it will not double, it will not increase. It starts plateauing also. But beta HCG, every time the blood test they cannot do. Usually it doesn't double within 48 hours. Then we want them to do a ultrasonography. Pregnancy test is a theory. I am here, it is telling I am pregnancy. The lady is telling. But ultrasonographical scanning, as I always tell, it is a GPS of gynecologist. It will tell there is a sac, there is a heartbeat. So that will confirm, and a couple also will be happy. So usually we send them by 5th or 6th week to the dating of pregnancy scan, where the heartbeat and the fetal pole, we call it as a small fetal pole, will be seen, because pregnancy is in its normal place and it's growing very well. But we are equally concerned if the beta HCG is not doubling, beta HCG is not increasing, and she is having a lot of small spottings, as if menstruation is happening, that starts. That time you have to be very much aware of the ectopic pregnancy, which happens in this tubal pregnancy. Normal place is in the uterus, but in the tubal pregnancy, it usually happens in the cornual end or in this
fallopian tube.
Fallopian tube.
So it may rupture.
Because the ovary is here, from here the egg has gone and it has fertilized, and then it has come and sat in the uterus. But instead of that, if it gets stuck here in the tube, then it is tubal pregnancy, which is one of the very dangerous condition, because they immediately have to be under the medical care. They cannot manage it themselves at all. This is one condition. They have to come to the hospital, because the pregnancy will rupture there. It cannot grow more because it's a small, soft tube. So when it expands, it will, because uterus expands, fallopian tube cannot expand. So they will bleed heavily inside the abdomen, like 1 liter, 2 liters. So they'll come. This condition, we have to be very clear to them, even though they may not like any negative things, but we have to tell them something like this may happen. So till your scan shows that your pregnancy is in the cavity, even though pregnancy test is positive, be aware. So like this, pregnancy test has got a lot of implication. People will think pregnancy test positive, let us not go to the hospital, we'll go by 3 months. Before and all, where they used to go to the hospital, that is true. But before and all, there was no higher age group of pregnancy. Everything would happen within one frame of normalcy. The age of the marriage also was normal, and they used to live very healthy with healthy lifestyle. So pregnancies would happen even in some other countries. Some of the countries don't follow scanning immediately because they are very sure of the health of the couple. If that is there, then usually they can do the ultrasonography late also. But the idea of confirming is, one is, in our culture, the girl always wants to broadcast it to the mother, to everybody, that I am pregnant. But before that, we have to understand that it is very healthy pregnancy. Pregnancy, because they will have told, and suddenly she start spotting, bleeding, because the pregnancy sac is not healthy, and there may not be fetal pole. So, and another thing is, she has conceived with little effort of fertility treatment. Fertility treatments, when it is given, there is a lot of hormonal value we maintain for the pregnant lady. And we make them be aware that within the 3rd to 4th week, before missing the second only, they are supposed to do the pregnancy test. So there the conditions are entirely different. And the medical support also is too much there. So like this pregnancy test, whether it is positive, weakly positive, and false positive, and false negative. These categories they have to understand. If everything normal, it's okay. They will come with 1.5 months scan, fetal pole is seen, things are going well, the checkup continues once in a month, something.
So when do they get the false positive? When do they get the false negative?
Yes. False positive is something like there is a sac. There is a sac inside the uterus when they do the scan, but the heartbeat, everything has not come. Or they might have used some medicines also, heavy medicines because of some fever. That's why we always make a pregnant lady not to take anything if she is trying for pregnancy, because that can spoil the whole show.
Yeah.
Yes.
So even the drug should be taken except folic acid.
Yes. Even the simple paracetamol, all these things they should not take. Even in the food these days, I tell as a yoga follower also, even the food you be careful. Don't eat anything, whatever you get outside. Try to restrict yourself to the home food only. Because what you eat, it goes on your body and on your emotions also. Your good
Yes.
emotions are very important for the
That
pregnancy
is
too.
called Jaisa and Vaisa Man. Jaisa one, man,
Yes,
Jaisa tan.
yes,
So
yes.
ultimately,
So they have to,
what you eat is important.
yes. So false positives can happen in these cases. False negative usually in those people who are not ovulating properly. False negative, because they think they are they might be taking some ovulation drugs also, but still they have not ovulated. They think they are pregnant or they have cycled regularly, but there is no pregnancy sac or anything which is implanted in the cavity. So it is totally pregnancy negative test will come. And another important here is pregnancy false positive. It may be weakly positive. The beta HCG might not have taken up the main hormone which should support pregnancy. Because of that, because the pregnancy may be stuck in the fallopian tube, as we said. That time also there can be some spottings. The false positive pregnancy test will come, and baby is not growing. So this, especially when they are taking some hormones, they have like disrupted and got pregnant. So the sac will not grow at all. That time, again, that blighted womb, what we call it as, there is an attempt of pregnancy, but the sac, fetal fold, healthy pregnancy has not happened because beta HCG has not supported. Maybe she has some medical metabolic problems like diabetes. She may be having hypertension. It depends on the age, I'm telling.
Correct.
So the pregnancy test, if you are in a proper age group, planned very well for your pregnancy with a healthy lifestyle, then you have to really take it as a good moment for you. Otherwise, you have to really think and meet your gynecologist, whomever you trust, and try to take a better information about it.
So thank you, Parimala Devi. But I would like to summarize and tell what
Yes,
are your advices to the youngsters,
yes,
those who are married and those who are not married, or
yes,
those who are elderly primees and they are undergoing for IVF. All of them, they are different categories.
correct,
And for them, this pregnancy test is very, very important and crucial.
correct.
So what are the suggestions or the
Yes,
advices that you would like to
yes.
give?
I would like to say now we are in the one of the best part of the era we are. The high technological awareness has come and we are it is available for us. Use this technology for the best of you, I would say. And and another thing, the same technology. See now where we had in about 3 decades, 4 decades ago, we hardly knew about pregnancy test actually.
Yes,
It was
yes,
only as
yes.
you said, always you have taught us like by seeing the pelvic
I
examination.
know. And our professor, Dr. R.H. Kulkarni, he used to tell his wife is a better obstetrician than him because by looking at the gait and the way she walks, she would tell when she's pregnant. Whereas I have to do the pulmonary, examination, PV examination. So this is the jokes apart,
Yes,
people
yes,
should be aware of the
yes.
pregnancy test.
But
Thank
now
you
we
very
have a lot
much.
of technology. Pregnancy test, just handy. Go to a medical shop, he asks for the kit, he will give. But because of that, but our women have to decide, first of all, what they want. Because just because technology is available, they should not misuse. They should plan their marriage in a proper frame whenever they want. However, their backup and their family background is there. And
Plan
once
their
they're
pregnancy.
married,
Plan the
yes,
pregnancy properly.
yes,
Okay.
once they're married, they should plan the pregnancy and then go ahead and make their life more healthy and beautiful, I would say.
Better and lovely. Thank you. Thank
Yes,
you so much.
yes.
Namaskar.
Thank you, madam. It was a very great discussion. Thank you very much.
Thank you. Thank you.